Hi, everyone. Welcome back to the Dish on Aging. This is episode 5, and today we'll be talking about answering the question, where can I find a psychologist? One of the things that I have observed in my practice in the last year or two is that it has gotten so complicated in finding a mental health provider or a psychologist when somebody is finding they need someone to talk to. Maybe they're feeling anxious or depressed, especially for seniors. Maybe they don't think their memory is as good as it used to be, or they're going through a grieving process, or maybe somebody's primary care provider has said, you're having symptoms of depression, anxiety. I think it'll help if you go and talk to a psychologist. So the question becomes, how do I find a psychologist? I can think back 25, 30 years ago, it was super easy. We just asked a friend, a family member, even our own doctor, well, do you have the name of a psychologist? Generally, we'd only have to make 1 or 2 calls. We scheduled an appointment and we were good to go. Well, in 2021, it's much more complex. It gets down to, first of all, what type of provider are you looking for? What is your insurance? What is the problem or diagnosis that you're seeking treatment for? What is your age group? And then during this pandemic, are you looking for telehealth services or are you looking for an in-person appointment? So I will be talking about all of these, I'm going to say, topic areas on how to find a psychologist. So today I'm going to be talking about on how to sort through these complex questions of, well, what kind of provider am I looking for? What might be my diagnosis? Why does insurance matter? Why is that so important? And also, why is age group all that important? One of the biggest challenges is sorting through these 4 or 5 components to find somebody that you can call. The easy, summed up answer to the question, where can I find a psychologist? I tell people generally online. You're going to have to do just a little bit of research online to find the provider that you're looking for. Let's start with provider type. Because I am a psychologist, we'll start with, we might be looking for a psychologist who talks to patients, provides diagnosis, assessment, conversational counseling. Psychiatrists this day almost only provide medication assessments and prescriptions for medication for mental health diagnoses. There are also going to be clinical social workers who are very similar to the care that the psychologists provide in terms of the psychological counseling. Also, in the psychologist kind of category of professional is a neuropsychologist. A neuropsychological assessment, generally speaking, when being used by seniors, is being used to evaluate cognitive functioning. The use of neuropsychological assessment has become much more commonly used in the last couple of years. And this type of assessment usually helps a senior determine whether or not maybe some memory loss that they are experiencing or family workers are observing, maybe even a boss or human resources department where they work has requested that they seek a neuropsychological assessment. That will determine if somebody's memory functioning is normal for their age, or are they starting out with some cognitive functioning or memory loss, and if so, to what extent. So that's the care the neuropsychological assessment or the neuropsychologist provides. Most often, the neuropsychologists only provide assessment. They then don't provide necessarily follow-up care. So in summary, it's going to be the psychiatrists who provide the assessment for medication, then prescribe the medication. It's going to be the psychologist and the clinical social workers who provide the counseling services. The neuropsychologist is going to provide the assessment of memory, or how is the brain functioning, how are the thinking skills. Then there's going to be a whole host of master's level counselors who are going to be available. They are not master's level counselors, tend not to be as trained. They don't have as much training. And most insurance companies, and most of them may not even have licenses. So oftentimes they're going to be working under the supervision of either a psychiatrist, a licensed clinical psychologist, or a licensed social worker. So there's going to be a very large group of master's level counselors out there. That's going to become very important as I get into more detail about what insurance do you have and why that's important. What insurance you have when you're looking for mental health care has become, I think, the most important piece of these 5 pieces of this puzzle. The reason is we all pay a lot for our insurance, and therefore most of our insurance plans have mental health coverage. Not all, just so everybody knows, in this Philadelphia region here, many people who are have their health insurance through a union, or they're retired and they have their Medicare insurance through their union. A lot of those plans do not provide any type of mental health service at all, or if they provide care, they will only pay for the care at one clinic at one location. But by and large, most Medicare patients, whether you have original Medicare insurance or a Medicare Advantage plan, those are going to be the PPOs and the HMOs. Most of those insurance plans have mental health coverage. Each one of these plans is going to be very different in terms of what type of provider you can get access to. These plans also may vary in terms of how far you may have to travel to find a provider, and also these insurance plans may determine what level of training your provider will have. So that is also part of the picture. The third component of this puzzle that you're piecing together before you go online to look for your provider is, what are you looking for help for? What type of diagnosis? Is it depression? Is it anxiety? Is it family conflict? Is it a problem in your marriage? Is it a substance abuse problem? Is it health related? Is it bereavement? There are going to be some clinics that specialize. For example, there are going to be clinics that only provide substance abuse treatment and support. There are going to be some clinics that help everyone with symptoms of any type of stress, any type of anxiety or depression. Then there's going to be separate clinics or providers who provide support for marriage and family counseling. So the type of problem is also going to determine where you go for care. The fourth issue is age group. I am a in-network provider for original Medicare, and there are two groups of people who can receive original Medicare insurance. Those age 65 and older are automatically eligible for original Medicare, and then also those between the ages of 18 and 64 who have been medically disabled for more than 2 years. That group of individuals then becomes eligible for original Medicare insurance. So one of the challenges I face in my practice, I specialize in geriatrics, which generally means my patients must be between the ages of, or like age 65 or older. Because I have Medicare insurance, I'm a Medicare provider, I may be receiving a telephone call from somebody who is 30, has original Medicare insurance, and I have to explain to them that I'm not the provider for them because I specialize in senior issues. And they may say to me, well, I live with a brain injury. Was in a car accident. I live with a brain injury. And so then I will suggest to them to do the best they can online to find somebody a psychologist who accepts Medicare, who works with traumatic brain injury, people who are recovering from that type of medical condition. So you see, this can all be very complex and complicated. And on top of that, we're in the middle of a pandemic, and many behavioral health providers like myself, are only providing care through video or appointments or telephone appointments. Now, there are going to be a handful of patients out there who really want an inpatient, an in face-to-face appointment. And that's a little trickier. I've on my web page where I advertise in Psychology Today. So the first page of Psychology Today, I have indicated I only provide telehealth services at this time. Now, most people calling for an appointment are just fine with that. In fact, they're much more comfortable with that. So it's much more of a challenge, I think, because this option of being able to provide telehealth, even though it's been around for almost a year now during the pandemic, it may be difficult at times to know whether or not a provider is providing the care however it is you're looking for. So there's going to be a need to be making telephone calls to that provider's office just to find that out. In summary, you can see why it is getting more and more complex to find the provider that is going to be right for you. With that being said, there are a lot of providers working in this community. There are a lot of different insurance companies. There are a lot of providers accepting different insurance plans. And there are a lot of providers who specialize in working with specific age groups, pediatrics, adolescents, marriage, family and marriage. Those are generally going to be people in their 20s, 30s, and 40s. Fewer who specialize in geriatrics as I do, but there are some of us out there in the community that do specialize in, I don't necessarily call it a niche practice, but there are a lot of us out here. And so the task is how to match up what you're looking for to what's out there to find your appointment. And I encourage people to go to the internet. One of the easiest things to do is to simply find out what is your insurance and then go to the web page of in-network providers to then from that list. It can be difficult. You might have to make several phone calls. Try to find out from those in that list, do they have the provider type you're looking for? Psychiatrist, neuropsychologist, clinical psychologist, clinical social worker, and you might just have to call. Do you work with my age group? Somebody may find they're suffering from symptoms of post-traumatic stress disorder. Do they have somebody in that clinic, or does that provider provide support for your particular diagnosis? And you go through the list that way. So that is the answer to the question of how can or where can I find a psychologist. Because it takes a little bit of research, I tell people, if at all possible, try to start looking for a psychologist. If you're noticing you're starting to struggle in life, you're not sure if a few months from now you might need a psychologist or somebody to talk to, or maybe some medication for depression, start looking in advance. It makes it very difficult if somebody is felt some stress building up and now they just can't handle it anymore, and then they're on the telephone already overwhelmed and trying to make a lot of calls to find that right person for them, that right provider for them. So one of the reasons why I'm talking about this now is because I have been on the receiving end of calls for people really in urgent situations looking for a provider and just overwhelmed with the task itself. So the purpose of today's video is I wanted to help to prepare those of you out there who are wondering about what is the process of finding a psychologist. Also keep in mind that insurance companies might have some co-pays or co-insurances. For some individuals that can be cost prohibitive. I tell people generally, if you have an option in what insurance plan you are selecting, I advise people, if you think you're going to need mental health treatment or care, stay away from the HMOs. The reason why I advise people that is because the HMOs have, generally speaking, $40 copays every time you go to a mental health provider. For most people, that's just not affordable. They don't realize that in advance. So one thing I say, if you think you're going to need mental health care, stay away from the HMO insurance plans if you have a choice about it. And the other is, if you do have an HMO insurance plan and you call for a provider and you're told you have to wait 10 months because your insurance plan doesn't have enough providers. They're collecting plenty of revenue through premiums, yet they're not bringing on board enough in-network providers. So if you catch yourself in that situation, what you can do is, a lot of people don't realize this, you can call your insurance company and you can say, look, I'm having trouble finding a provider who can schedule an appointment with me. Your right is to have an appointment within 30 days of making the request. And all of the, at least HMO insurance companies, do have employees who will do that legwork for you. That legwork of identifying a provider who can schedule an appointment with you within 30 days. I just looked at my time. Time is up. I'm trying to talk about these very complex topics in aging through this series, through this YouTube channel series. And I want to keep it short and sweet, while at the same time tackling a very complex issue. So good luck in finding your provider. Eventually, you should be able to find what you're looking for. I look forward to talking with you all next week, where my topic will be, what can I do if someone that I love refuses to go to mental health treatment? That's another very important topic to be covered. Oh, before I finish up, I just remembered, I want to give an update on the COVID-19 vaccinations in this county. I want to give you all some statistics, okay? So today is Sunday. Gotta get my glasses out to get the date. Oh, I just saw it, January 24th. So some of you woke up this morning here in the Philadelphia region to hear that it is going to take a year for the first group of us to get our vaccinations. Okay, so pull yourself together, take a deep breath. Let's keep this in perspective. Let me tell you what's going on. I looked up to see how many residents live in the state of Pennsylvania, the Commonwealth of Pennsylvania. We have about 12 million residents. So far, a little less than 1 million doses of vaccine have been delivered to the Commonwealth of Pennsylvania. I did the math already. That's 8%. So we have enough vaccinations for 8% of our population. Wait a minute. You need 2 vaccinations, 2 doses to get your full vaccination. So 4%. So far, as of January 24th, 2021, we have had enough vaccinations delivered to the Commonwealth of Pennsylvania to cover 4% of our population. I'm going to give you another statistic. Those of us who, I call it at the front of the line, healthcare providers like myself, and then last week, Governor Wolf opened up the front of the line to anyone age 65 or older, or anyone with a medical condition. So that's approximately 3.6 million of us. So approximately 25 to 30% of the population of the Commonwealth of Pennsylvania is standing at the front of the line. Here's what the problem is. The vaccinations are trickling in. The good news is there are vaccinations, they're manufacturing them. The bad news is they're just getting to us, they're getting manufactured at like imagine a sink faucet, 1 drop at a time. So when we woke up this morning and saw the headline, it's going to take a year to get the doses. They're only talking about those of us at the front of the line. They're saying it's going to take a year to get the doses to those of us who are healthcare providers and those of us who are age 65 and older. So I don't know if I quite believe that. A lot can happen in a year. A lot can happen in the next month or 2 or 3. They might figure out how to manufacture these doses at a much faster rate. But I wanted you to all have this in perspective so that those of us who have our names on the list, we're going to start to wonder why we're not being called. And what's happening is the vaccination distribution sites at the end of last week got overwhelmed with calls, people confused about what's going on. So I want y'all to know what's going on. There is like a massive log jam. Okay. Oh, and by the way, here's how we also need to think of this. My county is saying it might take a year for me to get a vaccination. Guess who's in line behind me? I'm in the top 25 to 30% of the state. Behind me are first responders, school teachers, and then everybody else. So then it's going to be the question, how long is it going to take you all behind me in line to get a dose? And the answer is, I don't know. And let's be hopeful. Let's be optimistic. And let's know this could all change. And they could all of a sudden be able to make these vaccinations quicker and get them into our arms quicker. Something to anticipate this week, we're going to be hearing about the medical question. For those of you who received 1 dose and you're scheduled to get your second dose in 3 or 4 weeks, only to find out it's uncertain when you will be actually getting your second dose because they're not available. And I'm going to be curious to see what the medical doctors say about that. I don't think there's going to be any harm in that. I just don't. So I'm going to be curious to see what the medical doctors say about this. So we're continuing with our pandemic chaos, but we're, I guess, right on track. We know where we need to get, which is vaccinations for those who want vaccinations. I also want to give a word of encouragement and respect to those who are not comfortable receiving a vaccination. My word to you is I don't think you should worry about it because there aren't enough going around. This is becoming a particular issue within long-term care facilities where there are staff who is a question whether or not the vaccinations will become mandated or not. So far, they're not mandated. Well, maybe in one long-term facility they became mandated. It's not going to make a difference because they don't have a shot they can't put in your arm, number one. Number two, where shots are mandated, everyone still has a right to exceptions for refusing vaccinations. And those exceptions are religious exception and also medical condition exception. So I don't want anybody to think, my gosh, they're going to be fired from their job if they don't get a vaccine that they're genuinely not comfortable receiving. So that's my word of encouragement to you all on how to move forward with that. Okay, thanks a lot. Have a great week, and I'll see you next week.